Nurses here, do sit yourself down.
Thank you.
This film demonstrates the NHS Health Check, which aims to prevent heart disease, stroke, diabetes, kidney disease and some types of dementia.
Okay, I'm Jan, I'm one of the practice nurses.
Hello.
So, tell me, what do you know about health checks?
Well, not a lot really, just that you're going to check some things, I suppose.
Okay, would it be if I tell you a little bit?
Yeah, thank you.
Okay. What we're going to do is, between us, we're going to collect your story. I ask you lots of questions, if that's okay.
Yeah.
We fill in some forms, we fill in the computer, I'll weigh you, measure you, check your blood results, and then we will sit down together and have a look at what comes out and see how you can go about reducing your risk of heart disease and strokes, blood pressure and diabetes. Is that okay?
Yeah, that's fine.
Righty-ho. So what we'll first of all do, if it's okay with you, is we'll weigh you and we'll measure you. Pop on here.
Okay.
Once height and weight have been recorded, the patient's ethnicity, age, gender and previous history of heart disease are entered into the computer.
Before we do your blood pressure, we'll just give you a minute to settle down.
Okay.
You've no history of having a heart attack or a stroke, mini stroke, developed angina? No. That's brilliant. It's just good to check those things.
Yeah.
Okay. So what I'd like to do now, if it's okay with you, is take your blood pressure.
Okay.
But first of all, uncross your legs.
Oh, okay.
Yeah. Try relax them forward.
Yeah.
And just relax yourself back.
Okay.
Just imagine you're a bag of water.
Okay.
Just give all that water as much room as possible. If you squeeze it, the pressure goes up.
Okay.
So, what we'll do is we'll take your pulse first.
Right.
When taking the pulse, it's important to detect if the patient has an irregular heart rhythm, because this can affect the blood pressure reading. An irregular pulse rhythm can be a sign of atrial fibrillation, a major cause of stroke. So patients should be referred back to their GP for further investigation.
I've felt your pulse for a little while now,
Okay.
and it's perfectly normal. It's nice and regular.
Oh, that's good.
So what we'll do is we'll go and we'll take your blood pressure.
Right. Okay.
These machines work beautifully when your pulse is regular.
Right.
The upper arm must be level with the heart.
So what we do is we pop the cuff on. There we go, and pop it on, not too tight.
Right.
There. Okay, my love, just relax. That's super. Can I go on further and ask you, smoking?
Yeah.
Where are you with smoking?
Yes, I do smoke.
Okay. Okay. So we have options here, Sheila. We've got light smoker, moderate smoker or heavy smoker. Which would be the best category, do you think, for you?
Moderate.
Moderate. So let's select that one. Lovely. And I also need to ask you about alcohol. So this is a form that we go through, Sheila.
Okay, right.
The consultation moves on to a discussion about alcohol use. Here, the healthcare professional uses a paper version of the questions to help engage the patient more effectively.
So we'll go through the questions.
Okay.
And the first one is, how often you have an alcoholic drink? What would you think fits you?
From this scoring system
Yeah.
here, I think it's probably number 4.
4 times a week. And when you do have that drink, on a typical day when you're drinking, how many would you have? And that's in units.
I probably have that one.
Right.
3 to 4.
3 to 4?
Yeah.
About
probably.
a couple of glasses.
A couple of
wine.
glasses, maybe a bit more sometimes. Depends if it's weekend, you know.
Alcohol risk is initially assessed using 3 questions from Audit C, or 4 questions as part of the Fast Alcohol Screening Test, FAST. If a patient scores more than 4 on Audit C or more than 2 on FAST, then you should go on to use the full audit assessment.
Have you or someone else been injured as a result of your drinking?
I'd had a couple of drinks and I was taking the dustbin bag out, thought I'd take it out before it gets smelly, and I fell down the back steps.
Oh, dear. So that gives you a score of 12. If we have a look at the bottom,
Yeah.
So 0 to 7 is lower, 8 to 15 is increasing risk.
Oh, right.
Okay, so if I pop that down, thanks Sheila. If we have a look here,
Yes.
that puts you in this percentage of the population.
Oh, right.
So in the whole population, A lot of people drink less in the safe limits.
Okay.
And some people don't drink at all.
Okay.
You're in this increasing risk for alcohol.
Right.
Would it be all right if I give you a little bit of information to take home?
Yes, that's fine.
Yeah, there's some information that other people can find useful. It may or may not suit you. It's quite a nice little leaflet there.
Okay, thank you.
Okay.
Yeah.
So, can I ask you about physical activity now?
Right. Okay.
Brilliant. We don't call it exercise these.
No.
Physical activity. So we've got a series of questions here. The first one is about work.
Okay.
So most of my time at work sitting, such as in an office.
Yeah. Well, I think it's probably that one because...
And then during the week, how many hours do you spend on each of the following? Swimming, jogging, aerobics, football, tennis, gym, or go for a workout? Come on,
none,
Sheila.
None.
None. And walking. How would you describe your usual walking pace? And we've got slow, steady, brisk.
I think it's steady.
Steady.
Yeah, I don't rush and I don't go slowly.
So let's press the magic button.
Okay.
And it says you're inactive.
Oh dear.
Oh. What we also do, as well as ask questions,
Ooh.
yeah, that's for you.
During an NHS Health Check with people over the age of 65, it's important to raise awareness of dementia and to help patients understand that lifestyle factors which affect your heart also affect your brain and the risk of developing some forms of dementia.
Here's some information. Should you be concerned about your memory?
Yes.
A family member's memory?
Yes.
Or a friend?
Yeah.
The place to go is, there's a really good website, the Alzheimer's website, which is very, very informative.
Okay.
And of course your GP have.
Right.
And there's a tablet called a statin.
If you are not using point-of-care testing, blood should be taken before the NHS Health Check appointment, so that the results can be discussed at the appointment.
My next door neighbour needs
Right, Sheila. So we've come to the end of collecting your story. Thank you very much. And this is your story. We popped it in together, didn't we, with all the answers you gave me. And what's happened is we've come up with a number, the red number there, of 20.58%.
Oh, right.
Okay. So that is the percentage risk for cardiovascular disease over the next 10 years. Would it be if I tell you a little bit more?
Yeah. Fine.
Okay. If we press this, what you see is 100 hearts.
Okay.
So if we imagine that those are 100 Sheilas,
yes.
just like you, they live at your address, they do your physical activity, they have your blood pressure, your blood results, yeah? Okay. If I invited all 100 of those Sheilas back to see me in 10 years' time, that 21, you see with the little tablets, that 21 of those Sheilas would have developed heart disease or stroke problems. Some would have died and some would have survived. So, the good news is there's lots of ways to lower that number. So we've collected your story and we've got it all in the computer here. Everything that you kindly told me. I just wonder, before we move on, would it be helpful for you to record it so you've got it when you go home?
I would really, because I probably won't remember it all otherwise.
It's difficult to... Do you want to write it in while I shout it out?
Yes, okay, I'll do that.
Okay, so for alcohol, you came out at increased risk, didn't you?
Yes.
Right, okay. I think it was 12. So if you, probably in the red there.
Tick the red, just tick it.
Tick it and put 12. So you tick that, and if you want to put 20.58 there, then we've got it
20.58
there. Then if anyone asks you,
it's important to make sure that patients with a cardiovascular risk score of more than 10% or with an abnormal test result, such as high blood pressure, are referred back to their GP for clinical management. You should also use these results to inform a discussion with the patient about lifestyle changes that could help to lower their risk.